my profession is as a physiotherapist, and with that role I work both with inpatients, so patients that are in the hospital. So I've seen people with COVID-19 from the start of an admission, back in the start of the outbreak, or when they became unwell, through their intensive care unit admissions sometimes if they end up there. I'm fortunate enough to see people through a range of settings and also through different stages of their illness, whether that's in that first stage as I mentioned, or moving into long COVID as an outpatient setting. Yes, I have worked with ME patients, and I think that most physios probably have, whether they realised it or not. So we do see some people who come into the hospital for different things, but have ME concurrently, or also, as I mentioned, through either private or outpatient settings, we see people for their ME or CFS. As a physiotherapist, seeing people with long COVID, some of the symptoms that we typically are involved in would be things like breathing pattern disorders, as well as managing fatigue with some of our other allied health colleagues such as occupational therapists or psychologists. But a lot of what we see are people either trying to return to activities and looking into symptoms that we could help with, such as their breathing pattern disorders, any anxiety related to that, as well as getting them back to exercise safely. Yeah, we do deal with people with pain a lot of the time, and what we have found with long COVID, which has been particularly interesting to us as physiotherapists, is that people who have had pain previously, so say like a back injury years ago, are coming to us with this pain that has suddenly flared back up after getting COVID and now developing long COVID. So we're working a lot with that type of pain, as well as sometimes pain from nervy type pain, or just long-term chronic pain. A breathing pattern disorder lives on a bit of a spectrum, so it could be pretty mild, which people don't tend to notice significantly, or it could be something like hyperventilation syndrome, if you've heard of that before, and everywhere in the middle. But a breathing pattern disorder or a breathing pattern dysfunction essentially means that you're breathing within excess of what your body is trying to do at that time. We need our breathing to respond to your activity, so if you're sitting and resting, your breathing should be nice and relaxed and calm, and you won't even know that you're doing it. But if you're actually then going to try and run or exercise, we need you to be able to adjust your breathing naturally and without thinking about it to those sorts of activities. In breathing pattern dysfunction, your body overbreathes despite the environment that you're in. So you may be sitting calmly, but breathing as if you're exercising. If you have a breathing pattern disorder, what people tend to notice, or maybe their whānau or friends might notice, is that you yawn or sigh a lot more than what other people might do, or you might actually see your breathing more than others. So sitting here, you look pretty relaxed, so I shouldn't see too much of your chest moving. It should mostly be your belly, or even very minimal movement at all. In someone that has a breathing pattern dysfunction or breathing pattern disorder, we typically see them breathing as if they're huffing and puffing away, even though they may feel calm and relaxed, or they may feel like their breathing is normal to them. It can happen for a number of reasons. Sometimes it happens simply from the amount of mask wearing that people have been doing, and that makes some people feel short of breath, which makes you breathe a bit faster, and then your body naturally adopts that pattern and keeps breathing that way even when whatever trigger has gone. The other thing could be anxiety, which often leads to you breathing a little bit quicker, and again your body forgets to kind of switch off that fight or flight response even when there isn't that sort of trigger around. But with COVID, what we've seen is that when people were acutely unwell, when they were very unwell at the start of their illness, they tend to be a bit more short of breath, or they could have been more short of breath, and that changes your breathing pattern, and then that's harder to get rid of when you do recover. As a respiratory physio, it's my favourite thing in the world, breathing, but I think that the breathing is so important because it actually controls a lot of your body's natural responses, those sort of automatic functions of the body that we don't think about. So your breathing controls things that happen in your brain by sensing or changing chemicals that are released or moved around, and it's how your body reacts to different triggers in one of the first ways that it possibly can. So it's really important that your breathing is nice and controlled and in response to what the body needs. Otherwise, that's when you can start to notice a lot of different symptoms, like being short of breath, particularly with exercise. It can change things like your heart rate, and it can make people feel really unwell, even though it is just breathing a little bit faster than normal. Breathing inappropriately or improperly can definitely lead to other symptoms such as brain fog or fatigue, especially because if you think that you're breathing faster than normal for the whole day, you're using a lot of energy in excess to what your actual body requires at that time. But also it can put you into a state of feeling quite anxious, even if you don't think that you're anxious, or rationally you can't think of any reason to be anxious, but your body puts you into that sort of state of fight or flight, despite the fact that there's no triggers around or no real threat around. So what we found as physiotherapists, and what's been known throughout the literature with dysautonomias and links to breathing pattern disorders, is that often if we treat a breathing pattern disorder, it can reduce a lot of the symptoms that are experienced through dysautonomias, such as things like postural orthostatic tachycardia syndrome, or POTS, if you've heard of that before. And what we found is that by actually treating breathing pattern dysfunctions, by trying to reduce that respiratory rate, or the rate at which you're breathing, we can control some of the dysregulation in your autonomic nervous system, which is mostly what's affected through that dysautonomia. If someone thinks that they might have a breathing pattern disorder, the first thing to try to realize or try to acknowledge is whether you think your breathing is actually different to what it should be. And by doing that, you can do some really simple things yourself at home, which might be asking your family or friends if they notice any funny things that you do with your breathing. Do you sniff a lot, or sigh a lot, or suddenly take big deep breaths? Now, some of these things are normal to do, but if you're doing them every couple of minutes, or a couple of times an hour, it could tell us that you've got a breathing pattern dysfunction. Another thing is, when you are feeling quite calm, is to actually look at your breathing and see whether you're breathing really low and slow. So when I say low, I'm talking about belly breathing or abdominal breathing, nice, calm, relaxed breathing. And you can do that by popping one hand on your chest and one hand on your tummy and just holding it there for a couple of minutes and seeing where you feel the rise and the fall. And if you feel that that's mostly in your chest, even though you're relaxed, it could be a sign that you have a breathing pattern dysfunction. Otherwise, if you're noticing that you do feel short of breath, or that you do have any of those dysautonomias or think you may have, it is really good to see a physiotherapist about that, especially one who may be trained in breathing pattern dysfunction, so that they can do an assessment. And that might just be a questionnaire and looking at your breathing itself to see whether your pattern is different or not. A lot of the trouble that we have as physiotherapists is getting the person to recognize or realize what is different about their breathing now than what would be considered normal or normal for them. Once people can recognize that change, it's a lot easier to treat, and usually that's the biggest step. Definitely, I think, as I was talking about with those exercises with your hand on your chest and on your tummy, often it's best to think about doing this, as I said, when you're calm, and sometimes even lying on your back with your knees bent, just to take away postural changes with that. This can be really hard to do, though, without someone guiding you as to what is different about your breathing, but you can certainly start there. Think about breathing in through your nose and out through your nose if you can. If you can't do both of those breaths through your nose, get the in breath in through your nose and then purse your lips to try and slow that breath out so that we get that nice slow breath in and out. And then think about trying to use your tummy to breathe if you can. So getting a low, slow, deep breath and trying to control that so you're not breathing too quickly. If someone's just starting out, I think it's really important to make sure that the quality of the breaths that you're doing when you're trying to retrain your breathing pattern are of good quality. So instead of trying to do 100 or a big chunk of 20 minutes of this good breathing, you may find that you can only do 2 or 3 before your body naturally reverts back to that other pattern. And you'll notice that if you have your hand on your chest and your belly, at which point then you need to stop. Just try and relax your body and then try again. If it gets to the point where you do 2 or 3 breaths and they were really good breaths, but then you try and go back to it and you're noticing you're still out of rhythm, then it's best to just stop, pause, and come back to it at a later stage. Everyone will be different, but start small with even just doing this for a couple of minutes in the day, even if that's 3 or 4 good breaths and then having a break and then going back to it. And eventually what you can do is start to progress that into different positions such as sitting or standing, and even things like different tasks like when you're at work or when you're driving or something that may perhaps trigger you. POTS is postural orthostatic tachycardia syndrome, which is a syndrome that has been well known in certain communities for some time, but has become more popular or more well known now that long COVID has come into the limelight. It's something that occurs when you are lying down, and then when you stand up quite quickly or just stand up, then your heart rate increases by 30 beats a minute, or if you're a child or a youth, it may be 40 beats per minute. So your heart basically increases in its rate or gets quicker just from going from one position to another. I think the difference is that your body shouldn't need to react quite so much to a smaller movement. Obviously, if someone's unwell at the time, it may trigger this to happen more. But what we don't want is that for that fight or flight response to take control of your body at that point in time. Also, what we know is that when you're changing that position, your blood will pool into your feet, as if you imagine a bottle of water. If you lift it up from being horizontal, that water's going to drop to the bottom. What the body would naturally do normally is try and then pump that back up to the brain so that the brain is getting lots of blood and lots of oxygen-rich blood. If that's pooling in your feet, your heart tries to beat faster to get it back up to your brain as quickly as possible. But what that means is that if that doesn't work so well, people can feel quite faint or dizzy. Sometimes people will faint or pass out, and people feel quite nauseous as well. I think the main thing is that they should seek attention from their GP or their family doctor first, particularly if they're not so unwell that they need emergency care. However, of course, they should seek that if they are that unwell. The range of symptoms can vary significantly. So some people will have very mild symptoms. They may feel slightly dizzy or slightly nauseous, but it goes away and they might ignore that. Whereas for others, it may completely change the way that they can carry out their work or their leisure activities. The main thing would be seeing your GP or family doctor, as I mentioned, just to rule out anything sinister or nasty and make sure that you are safe and well. And then from there, physiotherapists can look into your breathing to see whether that may help to improve some of your symptoms. There are other things that the medical professionals can advise, such as changing the amount of salt in your diet, as well as having smaller meals but regularly throughout the day, and trying to recognize some of the triggers for your symptoms as well, which for some people could be as simple as being in a hot environment or standing in one place for too long. Post-exercise malaise is when you feel an overwhelming sense of fatigue. But when I say this, it's not just I went for a run and now I'm naturally tired. This is fatigue well above and beyond what your actual exertion would have caused. And this could happen within hours of the exercise itself or the exertion itself, or it could actually happen within 72 hours of that. And your symptoms can then wax and wane. from there, so they can get a little bit better and then something really small can trigger this. With post-exertional malaise, it can actually occur from either physical activity, like I was mentioning with exercise, but it could even be from mental or cognitive fatigue as well. So things such as trying to return to work, trying to read a book. I think one of the first things that you can do is start to try and track what activity you're doing so that we can really get a sense of what it is that's triggering these symptoms. The main thing is to not ignore it, because the more that you try to just push through it, the worse that it can actually get. And again, trying to figure out whether this is actually happening earlier on is a lot easier than 6 months down the line when people have been fatigued for a long time. It's really important to be aware that this isn't just deconditioning. This isn't just because you've been unwell for a couple of weeks and getting back into the gym or getting back to your normal activities, it will get better. It actually might not. We need to really look at your activities throughout the day, try and plan what you're doing, pace what you're doing, meaning that we put them in the right order or make sure that you're prioritizing the most important tasks for that day and working within the amount of energy that you really have so that we don't tip you back over into that sense of fatigue. So trying to get back to your normal exercise, for example, if you just try and increase that gradually as you go, typically people find that their symptoms get worse, and that's where experts or professionals can help to guide you into getting back into the exercise or the activities that are most important to you, but safely. I think when people come to see health professionals or people that know about long COVID or any condition for that matter, what they could do to help would be to have a bit of a symptom log. So looking at what symptoms you're actually experiencing, and perhaps if you can notice any sorts of trends in these. So is there a certain time of day that they're happening or that they're worse, a certain time of the week, or even just following certain activities? That can be really helpful. I think coming into it with a real open mind as well. Typically people see physiotherapists, for example, as therapists that help with ankle or sports injuries, but in fact our expertise goes much further than that. We focus on a lot of different aspects of the body. So coming into it with an open mind rather than looking at us a bit strangely when we ask you some very funny questions, there is a purpose to them. I think the other thing is acknowledging that if you are really fatigued or tired, talking to whoever you're seeing about how long you feel you could last in that appointment could be really important. And that might be that we could break down the appointment into different stages, or we could send you some of the questionnaires or some of the questions beforehand so that you can send them back to us to have less time in a waiting room or in a clinic. And even options like virtual appointments or phone call appointments if you get to that day and on that day you may not feel well enough to attend the appointment. We do recognise that these symptoms change and are sometimes uncontrollable, so those sorts of things can be really helpful for us. I think the main thing is recognising that long COVID symptoms can be wide-ranging. And not only that are there over 200 symptoms that we could potentially attribute to long COVID, but some could be very severe and some could be very mild, but they all matter. And actually recognising these symptoms, sometimes talking to someone who has either experienced long COVID themselves may make you realise that, or talking to a professional who's dealt with long COVID before can really help you to link pieces together, but then make action to reduce a lot of these symptoms relatively quickly.